I have Parkinson's, and now I have deep brain stimulation, and it changed my life. Changed it really well. Changed it for the good.
My wife said she remembered me having tremor or my hands would shake when we first started dating in my early 20s. This was a struggle that I had to deal with, and now I don't have to.
So we started our Deep Brain Stimulation program at Chandler Regional Medical Center in summer of 2018. Deep brain stimulation is a therapy we use to treat movement disorders. The most common uses we use it for are Parkinson's disease and essential tremor. It is also now used to treat dystonia and epilepsy, and it's very exciting because there are a lot of new clinical trials going on to explore in other disease processes that deep brain stimulation can be used to treat, such as Alzheimer's, stroke, so it's very exciting.
How are you doing? Good to see you.
Good to see you.
So I came in with my device off from last night, and so my tremor was pretty active. Try to stay in the line?
Or just, yeah, just
try
maybe connect the dots, yeah.
You can see from this page that it's not very good. It's pretty much hen scratch and barely able to stay within the lines. And my writing sample at the top, and it's pretty awful. And then I turned on the device. And gave it a second, and it was pretty quick. I mean, when you turn it on, your tremor literally disappears within just a few seconds, and I was able to do this. That's what I've experienced the whole time since having the DBS surgery.
The surgical process itself, we try to make it as smooth and as easy as possible. You come in the morning of surgery. It's about, to implant the electrodes, it's about a 90-minute, so an hour-and-a-half procedure. A little bit of time on the front and the back end to go to sleep and wake up from anesthesia. So probably you would spend 2-3 hours of total surgical time. You come out of surgery, spend one night in the hospital, and then probably 98% of people go home the next morning. And then typically a week later, you come back, and then as an outpatient procedure, we connect the electrodes up to the battery, which is on the chest, kind of like a pacemaker for your heart. And then that is about 30-40 minutes, and then you go home the same day after the battery is connected. The device is then turned on by a neurologist who then does the programming and adjusts the settings to fine-tune and make sure that the device is at the right settings to control the tremor and any other symptoms that may be affected, whether it's tremor or Parkinson's.
I had the surgery, and I've been very benefited from that day forward. Big difference. I have motor skills that I haven't had for 15 years. I can ski again. I can do a lot of things. I play baseball, I ski, I hike. I do some amazing things that I couldn't do for the last 5 years of my diagnosis.
Almost right away I noticed that I was able to do things a little bit more efficiently. I could write better, keeping notes and things like that I could actually read after I wrote them down. The fog of that I had experienced was pretty much gone, because by then I had been off the medications for almost a month.
I think the important thing for people to know is that there is a very safe and well-established and successful therapy that can help them. When medications don't, or medications have side effects that prevent them from doing things that they want to do or need to do, it's a privilege to be a part of that process and be able to help people regain their life back and be able to work and, you know, have a healthy, fulfilling personal and professional life.